Thank you so much for attending my lecture series, Taking Control of Language Impairment After Stroke and Brain Injury. Today, we're going to be talking about dysarthria. That is when someone has scanning speech. How are you? Or they could have maybe a slurred speech. So we're going to be talking about what dysarthria is. A lot of people have dysarthria and they don't know that they have dysarthria. So my name is Liz. I am the owner and speech language pathologist at Healthy Speech Solutions. I specialize in online speech therapy care in North Carolina and Florida. It's a pleasure to meet everyone here who's watching. So there are a lot of different types of dysarthria. However, I wanted to make known that we're only discussing dysarthria as a general term, meaning I'm not going to be talking about all the different individual types of dysarthrias. I'm just going to be talking about general patterns that dysarthria has. So as we're talking about the dysarthrias, I want you to think to yourself, does this sound like me? Yes, maybe I should see the doctor. Maybe I should see a speech therapist, okay, to take a look at it. So dysarthria is a speech disorder, meaning it's caused from production errors in your ability to communicate from muscle weakness or muscle discoordination, okay? And this is what can result in slurred speech, how are you, or talking very slowly, and it can make it very difficult to understand. Common causes of dysarthria can include the nervous system breaks down and it can cause facial paralysis, just like what we have over here. You see how this side of his mouth is raised up, this side of his mouth is raised down, and that can be an example of facial paralysis. And if this part of the lips is facing down, it means that it's not activating the muscles as required to communicate, and that can cause weakness. So imagine if you're trying to talk and only one side of your mouth is activated, working, of course you're going to sound slurred because it's not symmetrical. Your lips, your tongue, and your jaw, they're weak on one side of your mouth, and that's going to impair your ability to talk clearly. This can also impair throat muscles. Your muscles can also get weak as well. So think about it. It's not just your lip that's weak. It could be the side of your tongue. You can stick out your tongue, and the therapist could say, stick out your tongue, and you can go like this, because one side of the tongue could be stronger than the other. So of course, if one side of your tongue is stronger than the other, and you're shifting to the side, how are you supposed to be able to produce a strong t sound? Because if you're going to make a t, you can go, ugh, because you're not able to put the tongue where it's supposed to go because of weakness. Oddly enough, dysarthria can also be caused from certain medications that you can take. It can cause the slurred speech, this muscle weakness that you might be experiencing is affecting your ability to communicate. That's when it's really important, if you have a lot of these symptoms we're going to talk about, is to talk to your doctor, because the doctor could evaluate your medicine and see if it could be something as simple as treating the medicine, changing the dosage of the medicine. If it's not medicine related, if it's from a stroke, if it's from specifically a brain injury, then that's where it could help to get an order and permission to see your speech therapist to try to work on strategies to improve your ability to communicate. So what is dysarthria? Let's go a little bit more in depth. Dysarthria, we said, is weakness to the muscles and in coordination. So it's slow speech. It's not really articulated when we're trying to communicate. Or you could have really rapid speech. How are you today? I'm doing really fine. Blah, 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 blah. What did that person just say? And it's because the person isn't able to control the speech that they're producing, and it starts to speed up. I told you there's a lot of different types of dysarthrias that are out there. We also have difficulty moving the facial muscles or the tongue. We had talked about that earlier, where you have that facial droop we talked about. One side of your mouth works and comes up and you can smile, and then the other side doesn't, it drops down. That's a really good example of how your tongue and your lips aren't going to work like they're supposed to. Your jaws aren't going to work like you're supposed to. So of course you're not going to be able to articulate if the muscles aren't working and moving, having the range of motion like it's supposed to. Like you're supposed to talk, you're supposed to go ta ta, and you can't even lift your tongue up. It's too weak. Of course you're going to have difficulty with articulation. is inability to speak louder than a whisper. You might be talking really softly, but you're not able to speak up for people to hear you. That's also really common if you have a dysarthria. Or you speak too loudly and you can't control your voice to talk softer. So it's a lot of different types of dysarthria. You could have abnormal speech rhythm when you're talking. How are you today? That's known as cerebellum, okay? That's a toxic dysarthria. There's so many different types of dysarthria that is out there. You have a strained, raspy, nasal sounding voice. Oh. Your voice is sounding raspy. You're straining to get the airflow out to communicate. So of course, you're not really getting the sounds out. It's going to sound like a strange, strangled voice when you're communicating. And that's going to be a breakdown of the airflow in the cranial nerves, breaking down that's affecting ability to communicate. You can also have monotonous speech, meaning, how are you today? I sound like a robot. I have no inflection in my voice. That's also really common with dysarthria. Or you could have an uneven speech volume, meaning you talk really softly and then you talk really loud and then you talk really softly because you're having difficulty controlling your speech volume and keeping it at a normal inflection that people typically have when they communicate. Every language dialect has their own inflection. And with dysarthria, it disrupts that inflection when we're communicating. So the causes of dysarthria, okay? So it can be a location can impact the type of speech sounds produce. It's kind of cool. So for example, if we're talking about right here, this is where the cerebellum is. This, for example, can cause ataxic dysarthria. And this is what we had talked about earlier. It has a scanning speech where I am talking to you. And that's where the therapist is trying to smooth out your speech patterns to make it sound clear. You're really pushing those sounds out to communicate instead of saying, how are you? And that's because here your cerebellum had been affected from an injury of some sort, whether it's a stroke, a brain injury, or something else that's going on. You also have the basal ganglia. This can cause hypokinetic dysarthria. And this is because the basal ganglia controls your ability to have pitch and your ability to have different loudness volumes. It affects your ability to produce stress on your speech, okay? And it can also cause imprecise sounds when you're talking, so it's really hard to enunciate. So that's a discoordination in your pitch and your loudness and your stress of when you're talking, that intonation, making your speech more monotone. Or maybe it's far from it and you're really exaggerating those inflections in your speech because you don't have control. And the speech indirectly is going to be hard to understand. So that's all factored. So it's amazing how different parts of the brain creates completely different aspects of dysarthria, which is why we're just talking about dysarthria in general. So another aspect is that causing dysarthria are cranial nerves. Oh my gosh, more anatomy, physiology. I'm sorry, you guys. So cranial nerves is super fascinating because cranial nerves can affect the innervation in your face muscles to be able to produce the sounds that you want to produce. So I really love this picture. I mean, first you got to get past the fact that this guy is pretty ridiculous looking. But what I like about it, if you take a look at it, is we have these different numbers that's breaking apart. So we have the 8, which obviously has to do with his ability to hear, the acoustic nerve. The 7 here has to do with the facial nerve, okay? 11 here has to do with the accessory nerve, has to do with the limb nerves. You have the 10 here that has to do with the vagus nerve, okay? You have the 12 nerve here that has to do with the hypoglossal, okay? We have the 9 here that has to do with glossopharyngeal. But what you really need to gather from this is not that I expect you to know all this, but when you're studying this, the number here is associated to the different part of the cranial nerve that is affected on the facial muscles, which I think is pretty awesome. It's a lot better than having to look at numbers sticking out of a brain. So we're going to talk about first on the trigeminal nerve, okay? So that's here, so number 5. So you can see it's right across the face. And this has to do with jaw movements. And if you're having jaw movement, it's going to deviate to the weaker side. So if your right side is really weak when you're moving, it's going to prefer the right side. So if your jaw isn't working like it's supposed to, and if it's not aligned, it's going to cause your jaw to hang open because you don't have the strength to keep it closed. It's going to affect your ability to produce certain sounds. Because think about it. If your jaw hangs open, how are you going to produce a sound that forces your lips to curl into a circle? How are you going to be able to produce those sounds if you can't even close your jaw? You're going to have decreased sensation in your face to communicate as well. If you're not able, so think about it. Have you ever gone to get maybe cavities or go to the dentist and they had to numb your lip? Think about, or numb your jaw. How difficult was it for you to communicate? I don't know about you, but I had slurred speech after. And then I kept biting my lip because I couldn't sense my body when I was communicating. Well, of course, if you're having decreased sensation on your face because your trigeminal nerve has been affected, of course it's going to be hard to communicate. You're not even sensing it. Here we have the facial nerve. As you can see, it can control the upper, like the forehead, and control the mouth part. And this can cause facial paralysis. This is really common when someone has what we had talked about, where you have that facial droop where one side is higher than the other side. Or you notice that maybe you have an eye that closes on one side and then it opens on the, and then you have the other side of the eyes are open. And it's because of that relationship of the facial nerve is just not working correctly. So it's like, I don't know, I'm really bad at this imitation here. But this can cause the inability and difficulty with lip rounding and spreading for vowels. So it's like, ah, ooh, ee. It's really difficult to open your mouth wide enough to be able to produce those sounds. Pop, 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 bah. If your lips aren't moving like they're supposed to, if one side is impaired and the other side's working, it's going to create like a muffled, slurred speech sound because you're not able to articulate as clearly as you normally do. Okay. We have the glossopharyngeal nerve. This can cause reduced gag reflex. Okay, and I know there's a lot of debate on whether reduced gag reflex affects swallowing, but we're not talking about that today. We're talking about how it has an influence on your ability to have resonance and your ability to have phonation. The glossopharyngeal nerve is very involved in your ability to produce sounds. I'm not talking about the B and the P and the T and the W. I'm talking about your ability to be able to produce sounds just to come out of your mouth and get it to come and speak clearly and have a really good speech quality to it. I don't want it type of sound. I want it to be clear, very clear sound, and that can affect speech clarity when you're communicating. The vagus nerve here. This is very, very location on the vagus nerve location, just to kind of make that clear, but I'm going to keep talking about it very generally. So the vagus nerve can affect your hoarseness when you're communicating. How are you? Your breathiness. How are you? Can affect your weak pressure consonant. Your L and your R can affect your how are you and how are you when you're talking. It has a lot to do with intonation, has a lot to do with inflection, has a lot to do with pitch range and vocal quality. So it's incredible how all of these different cranial nerves can affect your ability to communicate depending on what's been affected. So that's why if you've ever been in the hospital for any reason, you probably had your physician was doing neural tests, your nurse was doing neural tests, your neurologist was doing neural tests. And it's because they were taking a look at the cranial nerves to see if all your cranial nerves have been affected for the reason why you're in the hospital, whether it was a stroke or a brain injury. So that's why sometimes they'll stick a needle like on your arm or stick a needle on your cheek and be like, did you feel that? They'll ask you to smile, they'll ask you to pout, they'll ask you to wave your eyebrows up and down just because they're checking to see your cranial nerves if they work. When I worked in the hospital, I saw them doing it all the time whenever someone's come in if they just had a stroke. So really, dysarthria is, you know what you're saying and it's just not coming out like it's supposed to. So like this dog, for example, is supposed to say bark. And what does he say? He says, meow. Oh, poor dog. Okay. So remember, if there's a disconnect Or it could be bark and it goes bark. Or it could be bark as well, could be I go because you can barely get the sound out. So there's a disconnect from what you're trying to say and what's actually coming out. So that's what dysarthria is. So as always, thank you so much for attending my lecture series. I really hope it's been helpful for you and you've been really learning a lot about dysarthria, and prior lectures have been about apraxia of speech, Broca's aphasia, right and left side of the brain. It's a lot of wealth of information I've been giving you, and I really hope it's helping you. And I'm really hoping listening to the lecture is opening your eyes to being like, that's me, and I didn't even know it. So if you can, please keep an eye out for my next lecture. It's going to be on speech therapy strategies to improve your communication when you have dysarthria. And we're going to be focusing on more, we're going to be focusing on the dysarthria speech. It has to do with very slow, slurred speech when you're communicating. That's what we're going to be focusing on. So have a wonderful rest of your day. And I hope you enjoyed my lecture series so far. And I hope you keep an eye out for me for my next one. Bye.